This is Abigail Thornsberry at Nikki Rio. I just wanted to go through a little bit about what Phase 2 project is about. This is the PowerPoint that I use all the time when I am introducing the project phase to individuals in the program. However, you'll notice throughout this PowerPoint, there are a couple of slides that mentions 11 weeks. Right now, I'm not focusing on 11 weeks for us because I would like to get this completed in about 5 to 6 weeks to get you on the track to taking this exam. However, even though we're cutting this down, I do want to emphasize that this is an important part in the program because it helps you ingrain those skills that you've just read and learned. So let's go through. So our principal goals, in general, it's just basically showing you that you're able to apply the health IT skills into a real-world setting and be able to utilize the skills to help you also increase in your understanding. I think I'm not clicking the right button here. Sorry about that. Okay. Okay, so you can see in the deliverables here, there is 11 weeks mentioned, but we're shortening this to about 6 weeks. So I'll talk about what you can and can't do in that time and what you don't need to do, that sort of thing. So project choices, we have 7 identified here. They're very general topics so that you can customize and you're at your own discretion to complete them the way you need to complete them in order to benefit your place of work or your employment setting. So these are ones we've used before: eliminating paper, workflow redesign, quality improvement, patient portal, contingency planning, training, IT improvements. And if you think of another topic that you want to work on that can help you ingrain these skills, just feel free to shoot me an email anytime or call me and ask me about it. So going through the next few choices, this kind of gives you an idea of the problem and the objective and what you need to do to complete the project. So for example, on eliminating paper, a lot of practices are utilizing an EHR system but are actually seeing an increase in paper usage. So your job is to figure out some sort of project that could benefit your practice that would actually help decrease the paper usage. Typically, tasks in this involves coming up with 3 outcomes. However, we may need to cut this down a little bit. These are SMART outcomes, and I'll talk about that in a minute, what it means to have a SMART outcome. You will be doing just a little bit of research, some planning, developing, and of course you're implementing your project. The biggest part about this project is being able to provide some sort of data or evidence to showing that you're reflecting your goals and your tasks. That doesn't mean that you have to have quantitative data, meaning that all your data does not have to be numbers to show an increase of anything. You can have qualitative data, which is just evidence that's showing that your goals are being met. And of course, we're completing the deliverables, which you will do. Then we have workflow redesign, and that's pretty self-explanatory. You're figuring out where you can redesign the workflow to increase your efficiency. Quality improvement, you can utilize different indicators that your office is working on. Patient portal, this has been a big one, especially last year. Individuals loved creating all kinds of different patient portal projects, and those were really neat looking into. A lot of places have established patient portals now and are not really focusing on that, but if you are, this would be a good one. Contingency planning, this is always good. I know contingency planning is always humongous. However, this would be taking a small portion of contingency planning, doing a small project in your efforts in creating a better contingency plan for your office. Training, any way you would like to think of a project to help train future staff. IT improvement, self-explanatory. Any other project that you would like to let me know about or you think needs work in your place or something that you're just really interested in, just let me know. So the deliverable 2 is just after we've picked your project, which is deliverable 1, we just need to work out the outcomes of your project. Basically, what are you wanting to establish with this project? These need to be SMART, meaning that they're specific. You are able to measure it, whether it's quantitative or qualitative data. It's attainable, because that's a biggie, because we're only doing about 5 to 6 weeks worth here, not 11 weeks. So you got to make sure your project is attainable and you're not killing yourself to get it done. it's relevant, and it's timely. And when I mean attainable, I will also help you make sure that you're not doing way too much. Timely, we're not doing an 11-week time frame like you're seeing here. We're doing about a 5 to 6 week time frame. Your outcomes, this is also part of your second deliverable on your outcomes. Just make sure when you're thinking about your activities and scheduling what you should do each week to get this accomplished, that you're thinking about your time frame and you're keeping it not too complex, not exactly simple, but not too complex, if that makes sense. And a provider agreement. Now, typically we usually have a form that the provider will fill out. I'm not worried about that right now. Just make sure your provider understands that you will be working on this a little bit in the office, and make sure that they are A-okay with this, because I don't want anyone upset, calling me, freaking out because they're getting in trouble and it's hurting their employment. So just make sure they are aware of this, and just let them know that this is very beneficial for them as well. Progress report, we're not worrying about that. Final report, so I'm actually going to combine the presentation and the final report. So you can do this any way you would like. You can do this on a Word document for your final report, or just do it as a presentation in PowerPoint, either way. So I will send this to you, and you can look at these 2 pages and just kind of see what you can do with your presentation. These are a little extensive, too much for 6 weeks worth. So just kind of sum it up a little bit. You're going to want a little bit about your problem, what you're doing, the activities and the outcomes you're expecting, the activities you're completing, and of course, absolutely, a data is a must. Just remember, like I had mentioned before, it doesn't have to be quantitative data. As long as you have data showing that you're improving or the change is working in some sort of fashion. And an evaluation, just quick, what you liked, what you didn't like, what you could have done better, what you think might help it in the future, that sort of thing. So all of this is a must in a final report and presentation. Again, this just kind of shows you how you can organize a presentation. That sums up phase 2 project. Now, again, this is only 5 to 6 weeks. Please don't panic. It's not that hard. I will work with you, and I will send you a couple emails to get some ideas and suggestions from you to figure out where we need to go with your project choice and your outcomes.